Hi guys, welcome back to my channel. This is Dr. Rajeshwar from yrpharmatube. In the previous video, we discussed the urea and monoacylureas type of anticonvulsant drugs. If you did not watch the video, hit the I button on top right of this video to watch it. To watch the other topics of anticonvulsants and other subjects of pharmaceutical sciences, click on the links given in the description box below this video. In this lesson, we shall learn about the benzodiazepines type of anticonvulsants and a specific drug, clonazepam. At the end of this video, you will be able to understand the benzodiazepines type of anticonvulsive agents and the specific drug, clonazepam. Benzodiazepines are used primarily as sedative hypnotic drugs. The classification, structure-activity relationship studies, and mechanism of action are described in the previous videos. Please search for the sedative hypnotic drugs for further details of benzodiazepines. Discussion here is limited to their use in the therapy of the epilepsies. A large number of benzodiazepines have broad anti-seizure properties, but only clonazepam and clorazepate have been approved in the US for the long-term treatment of certain types of seizures. Midazolam was designated as an orphan drug in 2006 for intermittent treatment of bouts of increased seizure activity in refractory patients with epilepsy who are on stable regimens of anti-seizure drugs. Diazepam and lorazepam have well-defined roles in the management of status epilepticus. The term benzodiazepine is a chemical name for the heterocyclic ring system whose core chemical structure is the fusion of a benzene ring and a diazepine ring. A diazepine is a heterocycle with 2 nitrogen atoms, 5 carbon atoms, and the maximum possible number of cumulative double bonds. The benzo prefix indicates the benzene ring fused onto the diazepine ring system. They are prescribed to treat conditions such as anxiety disorders, insomnia, and seizures. The first benzodiazepine, chlordiazepoxide, was discovered accidentally by Leo Sternbach in 1955 and was made available in 1960 by Hoffmann-La Roche, which followed with the development of diazepam 3 years later in 1963. By 1977, benzodiazepines were the most prescribed medications globally. The introduction of selective serotonin reuptake inhibitors, among other factors, decreased rates of prescription, but they remain frequently used worldwide. Benzodiazepine drugs are substituted 1,4-benzodiazepines, although the chemical term can refer to many other compounds that do not have useful pharmacological properties. Different benzodiazepine drugs have different side groups attached to the central structure, that is benzodiazepine. The different side groups affect the binding of the molecule to the GABA A receptor and so modulate the pharmacological properties. Many of the pharmacologically active classical benzodiazepine drugs contain the 5-phenyl 1H-benzodiazepine 2,3-H-one substructure. Benzodiazepines have been found to mimic protein reverse turns structurally, which enable them with their biological activity in many cases. Non-benzodiazepines also bind to the benzodiazepine binding site on the GABA A receptor and possess similar pharmacological properties. While the non-benzodiazepines are, by definition, structurally unrelated to the benzodiazepines, both classes of drugs possess a common pharmacophore, which explains their binding to a common receptor site. Not all benzodiazepines increase the conductance of the GABA A receptor. Flumazenil, an imidazole benzodiazepine, is an antidote for some benzodiazepine overdoses. The structural scaffold can even be used to target receptors other than GABA A. The various types of benzodiazepines and their respective examples have been given in this flowchart. Clonazepam. Clonazepam was patented in 1960 and went on sale in 1975 in the US from Roche Laboratories. It is a synthetic benzodiazepine derivative and its IUPAC name is 5,2-chlorophenyl 7-nitro 1,3-dihydro 1,4-benzodiazepine 2-one. It is 1,3-dihydro-2H-1,4-benzodiazepine 2-one in which the hydrogens at positions 5 and 7 are substituted by 2-chlorophenyl and nitro groups respectively. Clonazepam is a 2-chlorinated derivative of nitrazepam which increases its potency due to electron attracting effect of the halogen in the ortho position. Thus, it is a 1,4-benzodiazepinone and a member of monochlorobenzenes. It has a role as an anticonvulsant, a GABA modulator, and an anxiolytic agent. The synthesis of clonazepam begins with 2-chloro-2-nitrobenzophenone which is reduced to 2-chloro-2-aminobenzophenone by hydrogen over ranitidine catalyst. The aminobenzophenone is amidated by reacting with 2-bromoacetylbromide to give the bromoacetamide derivative. This is then further converted into aminoacetamide derivative upon reaction with ammonia. Subsequently, on treatment with pyridine, it then undergoes heterocyclization to form a benzodiazepine derivative that is 5,2-chlorophenyl 2,3-dihydro 1H-1,4-benzodiazepine 2-one. The nitration of the resulting product in mild conditions, that is using either nitric acid or potassium nitrite in sulfuric acid, results in clonazepam. Clonazepam is a off-white to light yellowish solid crystalline powder. It has a faint odor and has melting point between 238 to 240 degrees centigrade. It is practically insoluble in water and benzene. It is slightly soluble in acetone, methanol, and chloroform. When heated to decomposition, it emits very toxic fumes of hydrogen chloride and nitrogen oxides. It is stored in a well-closed container and protected from light. The mechanism of action appears to involve the enhancement of GABA receptor responses. It binds to GABA A receptors, thus increasing the effect of the chief inhibitory neurotransmitter GABA. Clonazepam enhances the activity of the inhibitory neurotransmitter GABA in the CNS to give its anticonvulsant, skeletal muscle relaxant, and anxiolytic effects. It acts by binding to the benzodiazepine site of the GABA receptors, which enhances the electric effect of GABA binding on neurons, resulting in an increased influx of chloride ions into the neurons. This further results in an inhibition of synaptic transmission across the central nervous system. Clonazepam is sold under the brand name Klonopin. It is a medication used to prevent and treat anxiety disorders, seizures, bipolar mania, agitation associated with psychosis, obsessive compulsive disorder, that is OCD, and akathisia. Thus, it is used in the treatment of all types of epilepsy and seizures as well as myoclonus and associated abnormal movements and panic disorders. It is a long-acting tranquilizer of the benzodiazepines class. It possesses anxiolytic, anticonvulsant, sedative, hypnotic, and skeletal muscle relaxant activities. It is typically taken orally, that is swallowed by mouth, but it is also used intravenously. Its effect begins within 1 hour and lasts between 8 and 12 hours in adults. This is the list of references followed for the lesson. That's all in this video. The benzodiazepines type of anticonvulsants and an individual drugs of the class clonazepam. In the next lesson, we will discuss about the miscellaneous anticonvulsive agents. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.